I'm Dr. Reddy, a dental practitioner. I'm here to show you there's another way to look at dentistry. I'm a holistic dental practitioner. I'm based in Santon, Gauteng, and in Springs, East Rand. I was born in South Africa and had this passion since the age of 4 years old to become a dentist. And during this journey, I explored about different aspects of careers, but I always came back to say that dentistry was what fascinated me and something that I need to perpetuate as a career. So eventually that I settled into my dental career and explored it. That I enjoyed dentistry, I found it fascinating about it and about enthralling about not just dentistry from point of teeth, I said how dentistry is relevant from the whole body system. What inspired me to look at the whole body system? I was brought up in an environment of a totally natural, holistic kind of living, that we grew up in infant stage on a farm, and whereby everything that we procured from the trees, and I was an athlete and I took part in natural sports and excelled at that, and always on a healthy diet. So when I did dentistry, I found that beyond teeth, there was something else that was relevant to dental science. Then I explored it more. I said as a dentist, we just study similar knowledge of information like the medical people. For example, pathology, anatomy, physiology, general medicine, general surgery, biochemistry, microbiology. So when I completed my dental career, I said the best way to know that if that's the journey I want to explore, let me do a series of courses. I did a series of certification courses, a series of diploma courses on almost all the subsects of dentistry over a period of about 3 years. And then eventually I found that this was not what I wanted. Then I began to study and I joined a group called Integrated Doctors Medical Group. And we were almost 119 people in the country during the 90s. And that way I became intrigued to say that dentistry is not teeth. As I realized that dentistry is about an applied science, about the clinical application of dentistry in terms of your whole body restoration of health. And that was a journey that inspired me to say that I want to explore this and study further. So what did I do in my career? So I practiced as a general dentist, but with a different tilt. My tilt was that to make sure that whatever I did was non-invasive, was non-aggressive, everything was harmonious to the body in the context of what they call functional dentistry and functional medicine. To know that the body has a capacity to regenerate and to heal itself. And what's the science behind it? Whether you're age of 5, whether you're 25, 50, if you've got a fracture of your hand, what happens? Where do you heal from? You heal from within yourself. Then I realized there's something that I can apply that in dentistry. So I began to explore it. I began to do less and less endodontics and invasive work, for example, what we know as root canal therapies. And I began to work with the guys in France and certain laboratories, and I worked with a material called biodentine. The biodentine gave me a window to the world to say that there's something I could heal tissues in the teeth, and that could provide a stimulus to heal the body. Let me explain that, right? First of all, if a patient has a large cavity in the mouth, the first thing the traditional dentist says, dear patient, right? I look at your x-rays, I look at it clinically, and you need a root canal, right? All of you know root canals is remove the nerves and because the blood vessels, and you're virtually making the technically dead. Then I said to myself, no. If a fracture can be healed in your hand within whatever the age you are, I said it can be in the teeth. So I began to research and explore it. Then I bumped into the website of Septident website, and I found that they had a machine called biodentine. So in the initial stages that, and I imported to the country myself, the later dental warehouse, an English company imported the material. So I began to do 30 patients as trials. So what did I do? Instead of doing root canals, I applied biodentine. And I found that not only through x-rays or what you call through the principles of radiology and radiography, and able to see clinically that after 12 weeks, I could see the discoloration from the patient. The team would say discoloration, having the yellowness of the dentine, which is called reparative dentine forming. And I was so excited and enthralled by it. Eventually, I did my 30 cases in my first 1 year of the launch of the material in South Africa between 2011 and 2012. And I found this became almost a platform to build on other aspects of applying dentistry in relation to whole body health system.